Hi there, I'm Machine Pun Kelly, and today I just want to talk to you real quickly about the gap and what that has to do with the Affordable Care Act, since a lot of people seem to not quite understand this. Back before Affordable Care Act passed, there was something called a gap, and that gap was between people who made too much money for Medicaid and didn't make enough money to actually pay for their own health insurance. Other people were either covered through their premiums or they had enough. But there were like 30 million Americans or so that just didn't make enough to pay for their own and made too much to qualify for Medicaid. So, one of the big things about the ACA is that they supplemented people that couldn't afford insurance. And so you'd go online and you'd go to the ACA and you'd pick out your plan, and it had to be a silver plan, but if you picked it out and you didn't make enough money, then the government helped offset some of that money. For some people, it was all, for other people, it was more. And it covers people from 138% of the poverty level to 400% of the poverty level. So there were some states also that expanded Medicaid, and that's important. That means that they covered everything up to 138% of the poverty level. Some states like Texas never did that, and so they still have a fairly high uninsured rate. And there are other states like California who did, and they have a very low uninsured rate. So this chart right here is the red line is states that didn't expand, and the green line is the states that did expand. And as you can see, while the red states still did better than they did before. So the bottom line is this: the ACA has helped millions of Americans get insurance that previously could not. If we lose these supplements, a lot of people are going to lose their health care, because if they couldn't afford it before, they're not going to afford it now.